Hey guys, so I just wanted to give you an update on what's happening fertility wise. So we had an appointment, I did a bunch of tests. I have not gotten the results back from those tests yet, so I will not be sharing that, obviously. So I had a pelvic and transvaginal ultrasound. So I've had this before. You go in with a full bladder and they check you out. They're just kind of looking at everything structure wise, and they need your bladder full so they can see past it. And then so you get to pee, and then they do the transvaginal ultrasound. So they do have to put something up inside, and it's not too bad. Because you're going to be off of testosterone anyways. Now, if you're still on testosterone, and your vaginal walls have broken down, it might be quite painful. And if that is happening, talk to your doctor about, you can get a suppository of estrogen that will just hit that area. Now, you can't really do that if you want to get pregnant. I mean, if you're trying to get pregnant, you should already be off of the testosterone. And your vaginal walls will go back to normal. It's really because of the testosterone that they're thinning out. Just a little side note there. And then I also did blood work. So they checked for vitamin D. Apparently, a lot of pregnant people have high levels of vitamin D. That you usually have to pay for. It's not usually covered. And then I had to do a sonohysterogram. So I've never done one of these, and it was very interesting. They take dye, and so they can kind of see your uterus, your fallopian tubes, all that kind of stuff, and make sure there's no blockage. There is also, I think they've done studies on that where, and I did read this online, I don't know how true it is, but sometimes after having one of those, you actually conceive afterwards for the next 3 months. You're more fertile because it's like washed everything out. I don't know how true that is. I mean, obviously, we've tried this month, so I won't be taking a test until probably early June. So if it did work, I'll let you know. And after all of these ultrasounds and things, I was in some pain. I did have discomfort. I did take a couple of days off from the gym. You will have discharge. If you see like brownish discharge, that's fine. Even like kind of pink red, it kind of looks like old blood. Just from all the activity in there. Cramping as well, you will have, so all that's normal. They will put you on like a short antibiotic, like maybe 2 days, I think I took. And like literally in like a couple of days, it was fine. Like I felt back to normal. Yeah, so those are the tests. And I did want to talk about like, just touch upon real quick. If you're going through this, make sure you have a good support system. And that meaning like your partner, if you're doing it on your own, make sure you have some support from your friends. It's a lot. And even when things are all checking out okay, I've been really stressed out about it. It's very worrying when it takes so long to get pregnant and you're like, I want it to happen now. But yeah, make sure you're taking care of yourself. Like this month, we relaxed a bit. Like you're going to have to take some months off. It's timing everything, like maybe you want to go on a trip, but you're ovulating. Like you should be able to go and do what you need to do, what's going to keep you happy and healthy. So I just wanted to put that out there too. And if there's any questions you guys have, please let me know. It's the reason why I'm making these videos. There's really no stupid questions. There's really no questions that are too personal. I mean, I'm pretty sure I've laid everything out on the table. And yeah, like if there's anything you're specifically thinking of, even if it doesn't necessarily pertain to my what I'm going through. I mean, I have, I have a lot of resources and things like that. So it's not like I couldn't send you in the right direction, or someone else following these may actually have the answer. So yeah, I just wanted to check in with you guys, and sorry it's been so long. I'm just trying to do some other things as well. But as soon as I know those results, and obviously as soon as I know I'm pregnant, I'm going to be posting more videos, and just recording that whole experience as well.